Hey there, I'm Dr. Joyce Knieff with Yggdrasil Naturopathic Medicine, and today we're going to talk about the science behind acupuncture. So I know acupuncture is becoming a more and more popular therapy right now, and some people explain how it works, and sometimes it's a little bit difficult to understand how exactly does this work. Acupuncture is a traditional therapy from Asia, and it's been used for thousands and thousands of years. So in order to explain it using science from a modern lens is a very new thing, so that's no surprise there. Now, there are several different theories in modern science as to how acupuncture works. One of them is called gate theory. Basically, the small needles that we use in acupuncture can influence the way that your nerves send signals back to your brain. In this sense, acupuncture is incredible for pain relief. So if you have something that is like, oh my gosh, this joint really hurts a lot, acupuncture can deliver pretty immediate pain relief through that gate theory explanation, where you treat that shoulder or elbow and you experience relief even from the first session. There's also a theory called the microinflammation theory, where the small needles create just enough inflammation in that area that it calls your body's immune system over to that area and says, hey, pay attention, there's something going on here that we need to fix. And this basically heightens the body's ability or attention to healing that injury. So acupuncture is also super good at sports recovery or any sort of injury recovery, including surgical recovery. There's also another theory that's a little bit more of a long-running theory for acupuncture, where the meridians of the body that are used in acupuncture line up very closely to what are called fascial planes and fascial trains. Fascia in your body is a catch-all term for all of the connective tissue in your body. So when you're walking around as a person, you aren't just bones and muscles and organs. All of these things are wrapped up in connective tissue, and this connective tissue is called fascia. So the theory is, by using acupuncture on certain points of your body, you can influence that fascia, that connective tissue chain that really influences the rest of whatever is wrapped up in that connective tissue. This is a big differing factor between acupuncture and dry needling. With dry needling, what you're doing is you're inserting needles directly into the point that perhaps this is where the problem is. This is where you have pain. This is where the issue is. But with acupuncture, the reason why acupuncture works so well for things other than musculoskeletal pain, things like fertility, menstrual issues, anxiety, depression, all of these other things that don't have to do with physical pain in one spot, is through this fascial theory. You can influence some distal or some organ that's in another place by placing needles on your limbs because of the influence of the fascia. So the theory is, if you can place needles in specific points on the meridians of your body, that changes the way that the fluid moves and the way that the micronerves work in your connective tissue, that it really influences the corresponding organ that is wrapped by the same plane or the same train, some people will say, of connective tissue. Those are some of the recent explanations of the science behind acupuncture. There's no better way to try acupuncture than to actually try it out yourself. If you'd like to know a little bit more about how acupuncture can work specific to your body, visit our website, give us a call, chat with us, come in and book a visit.